Hi everyone. In today's clip, I will talk a little bit about ulcerative colitis. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. Ulcerative colitis, or UC, is a chronic inflammatory bowel disease that affects the colon and rectum, causing inflammation and ulcers in the lining of the large intestines. Symptoms vary in severity, and they can include abdominal pain and cramping, persistent diarrhea, often with blood or pus, urgency to defecate, fatigue, weight loss and malnutrition, and fever in severe cases. Risk factors are immune system dysregulation, environmental triggers, diet, and gut microbiome balance. Complications can range from severe bleeding to perforation of colon, increased risk of colon cancer, dehydration, malnutrition, and systemic inflammation. The goal of conventional treatment is to reduce the inflammation, induce remission, prevent flares, and improve quality of life. Medications that are prescribed include aminosalicylates or 5-ASAs to reduce inflammation. They also do corticosteroids like prednisone, used for short-term for flare-ups. Immunomodulators to suppress immune response, biologics like infliximab and more to target specific immune pathways, JAK inhibitors, which is a new therapy for moderate to severe UC. These are a class of medication that acts like circuit breakers inside the immune system, and instead of broadly suppressing the immunity, they interrupt specific signaling pathways that gives the inflammation or drives the inflammation. But of course, just like all other medications, they come with their own side effects, such as increased risk of infection, blood clots, elevated cholesterol levels, liver enzyme changes, and possible increased risk of certain cancers. Now, at times, surgery can be recommended. A colectomy or removal of colon in severe treatment-resistant cases, which can lead to ileostomy or ileoanal pouches. Anti-inflammatory diet, avoiding sort of trigger foods, dairy foods, refined sugars, and processed foods are very helpful. Adequate hydration, small frequent meals, and probiotics for gut health. On the side of orthomolecular medicine, we focus on correcting biochemical imbalances with nutrients, antioxidants, and supplements to reduce inflammation, support gut healing, and prevent oxidative damage. The key approaches are through vitamins such as vitamin D3 and K2, which modulates immune response, and low levels of correlates to actually UC with UC flare-ups. Vitamin A and beta carotene, which supports the mucosal healing. Vitamin C, which is an antioxidant to reduce oxidative stress in the colon. Vitamin E, which is antioxidant support again, and minerals such as like zinc to support epithelial repair and immune function, selenium, which has antioxidant properties to reduce inflammatory damage, magnesium in the forms of glycinate, bisglycinate, or malate to help with cramping and smooth muscle function, amino acids such as L-glutamine, which is the fuel for intestinal walls and supports mucosal repair, taurine, which is an anti-inflammatory, it has an anti-inflammatory function in gut lining, fatty acids like omega-3, EPA, DHA, which are anti-inflammatory to reduce flare-up severities, probiotics and prebiotics to restore healthy gut microbiome and reduce dysbiosis. Also, lifestyle integration changes like stress management, exercise, adequate sleep, and low allergen anti-inflammatory diet. Overall goal is to reduce the oxidative stress, suppress mucosal healing, stabilize immune function, and prevent nutrient deficiencies that exacerbate UC. So one important procedure is application of vitamin E enemas to target local inflammation in the colon directly and provide antioxidant protection to the inflamed mucosa, as well as help reduce ulceration, bleeding, and oxidative stress, especially in sigmoid rectal UC. So typical composition of the enema would be vitamin E oil in 200 to 400 international unit per dose, usually in a neutral oil base like olive or MCT oil. The volume each time will be around 50 to 100 milliliter, 1 to 2 times a day, usually for 1 to 2 weeks. Ideal retention time would be around 15 to 20 minutes, but target is 30 to 60 minutes. Best case scenario, if you can hold, it would be overnight. So if you go for the overnight, just before you go to bed, you apply the enema and lie on your left side. To reduce urgency, you can make it in smaller volumes, like 30 to 60 milliliter, and make sure it's not cold and it's body temperature. If you feel urgency, just take a few slow breaths. It will go away within a minute or two, but if you definitely cannot hold it, then don't force it. And it should not be done during flare-ups, and make sure that there is proper hygiene that is being followed. Of course, always consult your gastroenterologist before trying enema therapy. No explanation, of course, is complete without looking at how our fathers and grandfathers dealt with this kind of ailments. In that system, we view UC as a humoral imbalance, often a combination of excess phlegm, cold wet, or yellow bile, hot dry in the colon, causing ulceration and improper digestion. Key approaches are normally, of course, through food and nutrition. Favor cooling, moist foods if hot bile is dominating, and warming, digestible foods if cold phlegm is dominating. Gentle, sort of cooked vegetables, barley water, rice water, and stewed fruits are much favored. Avoiding very cold, spicy, sour, or heavy foods during flare-ups, small frequent meals for better digestion, and herbal remedies like aloe vera, which soothes intestinal lining, fennel, chamomile, mallow, licorice root, which is anti-inflammatory. Of course, don't take it if you have high or low blood pressure, and these are all for mucosal sort of protection. Also, frankincense or boswellia, which reduces inflammation and can be infused or taken in very small amounts. Barley also softens the stools and reduces gut irritation. And of course, cleansing and detoxification with mild purgatives if constipation or toxin accumulation does happen. But in general, through combining barley water, light soups, warm herbal teas, and gentle herbal decoctions for 5 to 10 days, I recommend 10, or 10 days plus, and also a little bit moderate physical activity, you will see good results. During this period, all raw vegetables, meats, fried foods, or large meals are going to be avoided. On the emotional side of things, trying to avoid anger, stress, and fear, which are considered triggers for humoral imbalances, as well as adequate sleep and sunlight would be required. So for topical, there are also topical and local treatments that are very helpful, and that is sitz baths with herbal decoctions to reduce anal or rectal inflammation. Ulcerative colitis, like many chronic digestive disorders, is often linked to emotional and psychological patterns in both traditional and holistic frameworks. Emotions are sort of considered triggers or perpetuators of any system imbalance. For example, anger, frustration, irritability leads to increases in hot bile and inflammation. Fear, worry, anxiety increases phlegm and leads to sluggish digestion and mucus production. Suppressed emotions causes stuck energy in the colon, leading to ulceration or chronic inflammation. So modern psychosomatic insights also talks about chronic stress, unprocessed grief or sadness, fear of loss of control, feeling burdened or trapped, and high perfectionism or self-criticism for this. Now, the colon represents letting go, releasing what is no longer needed. Emotional blocks can manifest as physical inflammation when one cannot release anger, fear, or resentment. Strategies around releasing the stagnant emotions can include things like daily mindfulness or meditation for 10 to 20 minutes, emotional awareness journaling, gentle physical activity to move stuck energy, and therapeutic support if there's chronic stress, anxiety, or suppressed trauma in place, or even hypnotherapy. Hope this has been helpful. My clips are available on Rumble, TikTok, and YouTube. Like, share, and follow for more. Be the light.